Hi there. Are you struggling with shoulder pain or maybe just have restricted range of motion? Today I'll be sharing a simple technique with you that not only would help you to lower the pain, but also it will increase the range of motion. The total motion release technique is a unique technique that you use your good side to treat the painful side. Well, let's just dive into it. So before you get into the technique, I want you to see from scale of 1 to 10, where are you in a pain-wise, range of motion-wise. So for your shoulder, let's first you bring up the good side, good arm. You'll bring it up. So let's say you're going to be seeing the mirror. I'm bringing up my left arm. How far it can go, how high up it can go without any pain, close to your ear and reach up. And then you assess your bedside. So maybe you cannot bring all the way up. Okay, maybe it can come up here or not even that much, wherever you can. So you're going to be treating the good side, and it's so simple. So all you're going to be doing is bring your arm up, the good arm, without any pain, any discomfort. See how high back you can bring up, closer to your ear, and kind of reach towards the ceiling and down. You'll be repeating that 2 sets of 20. You're not swinging your arm, you're not forcing anything, just bring arm up, reach up, try to bring closer to the ear. Don't bring the shoulder up, keep it neutral, don't tilt your body. 2, 3, and just do that, 2 sets of 20. And then after that, try to bring the painful arm up and see if there's any difference from before. So let's say before your pain was 8 or 9 or 6, whatever it was. Did it change? Even just by 1 point or half a point, did it make any difference? Then you do another 2 sets of 20, and you keep doing that until you feel the pain gotten better. Now, from one day doing one time, it's not going to go from 10 down to 0. But this is something you can do. And like I said, before you do the technique, assess from 1 to 10 where you are, so you have something to compare it to, and then start doing the technique. 2 sets of 20, and then you can do 2 sets, like 3 sets, 4 sets, until in the next few days your pain will go away and you'll have a better range of motion. Please do the technique and leave a message in the comments. I would love to hear how you did. Until next time, you stay pain-free.